Well, today we have 186 new cases. Now, this is the largest that Queensland has had during the entire pandemic. We have none who are in hospital wards requiring COVID care, which is fantastic news. And Dr Gerard will give us some more information. So what we are seeing, some preliminary advice is that the vaccines appear to be working and they are protecting Queenslanders from getting seriously sick. But also, too, a big reminder to those Queenslanders that are not vaccinated, now is the time to go and get vaccinated. For those Queenslanders who haven't had their booster shot, please go and get their booster shot when the time arrives, because we know the booster is an added layer of protection. So, of course, we've had 15,698 vaccines administered by Queensland Health and 34,518 tests have been administered. So now 89.94% of Queenslanders have had one dose. So I'm pretty sure Queensland, we're going to hit that 90% mark today. So well done, congratulations. And of course, we're 83.55% have had two. Now, in terms of people coming into Queensland, we've had 257,000 people have crossed the border from Victoria, ACT and New South Wales since Monday. Obviously, everyone wants to come to Queensland, but we want to make sure that it is safe. So if you think about it, it's more than the population of Townsville has come into Queensland. We are a tourist destination. Now, because this variant, the Omicron, is highly contagious, we want to ensure that Queenslanders and people coming to Queensland have a safe Christmas and a safe New Year, and that means we need to do as much protection as we possibly can. If you get this COVID, you'll be off work from anything from 7 to 10 days, and if you're a close contact, you'll be off work for 7 days. So what we know is we want to keep our restaurants and our cafes and everything operating over Christmas and New Year. This is really important, as well as our critical industries across Queensland as well. So we're doing a lot of planning, and I want to reassure Queenslanders that all of that work is happening. So we're going to add some extra measures to continue to keep Queensland safe. And these are not onerous measures, but they're measures that Queenslanders have taken before. So in Queensland, we already have masks that are mandatory in supermarkets and shops, on public transport and in ride shares. So starting from 5 a.m. tomorrow, masks will be mandatory in cinemas and theatres. So this is for patrons and for people who work in cinemas and theatres, and also for hospitality staff. Now, we know in hospitality staff, people go around from table to table. We all don't have that full protection yet because we don't have the boosters. This is not very onerous. We have spoken to the industry and to the unions. They understand why this is necessary. Essentially, we don't want to have all of our cafes and restaurants going down because of the Omicron variant. So I think it's very practical, it's very sensible. And I'm quite sure that Queenslanders will respond positively to this move as we head into Christmas and New Year. It's only a few days out from Christmas and a few days out from New Year, and I want to ensure that Queenslanders have a very good Christmas. So I might just hand over to Dr Gerard, and then I'm happy to take a few quick questions because we have National Cabinet. Look, I might just address the issue of PCR tests if I can. I know that's been coming up a lot. Look, I spoke to the New South Wales Premier. We had a really good conversation. Our information is about 10% of their tests are for people wanting to come into Queensland, so not 80% or 90%, 10%. We are happy to get some further advice from AHPPC about rapid antigen tests. We will look at, if this is approved, that we may be able to utilise them in the new year from the 1st of January. But between now and the new year, we will require those PCR tests for people coming into our state. It was part of our plan, and we want to keep the virus out as much as we possibly can over the Christmas and New Year stages. And the final thing is just in relation to our vaccination hubs. There's been some reporting in the media. I just want to reaffirm that Queensland has 23 vaccination locations operating over the Christmas break. Of course, there's GPs and pharmacies, and we will have the same number of hubs that have been operating during this pandemic. So there may be some reports in other states of vaccination hubs closing, but if we do have some that are scaled down, we'll be putting extra ones out in different areas, but we'll still have essentially the same number, which is around 23. Did anyone have any quick questions for me before I go to the Chief Health Officer?
Premier, can you see that it's safe to say that Queensland is now holding the rest of the country at ransom? Because this testing is causing angst amongst populations in New South Wales.
10%.
Yeah, but Premier, have you seen the testing lines in New South Wales?
10% after. No, you've got this wrong.
But then you go to the airport.
With due respect, let me
finish.
Let's be respectful. It's okay.
I am being respectful.
No, let's just be very clear. No, it's frustrating for people in New South Wales because there are so many people getting tested because the variant, Omicron, is rampant in New South Wales.
But what about the people that are missing
And
out
guess
on
what?
going
I don't want it rampant here in Queensland at the moment. I want Queenslanders to have a good, safe New Year. I also have a lot of elderly population who don't have boosters yet. I want them to get their booster shots.
It's the sensible approach not to get tested if you have
I'm not going to discuss this any further because we're going to discuss it at National Cabinet. I've had a good discussion with the New South Wales Premier, but the rapid antigen tests have not yet been approved by AHPPC. They need to get the approval and we'll look at using them on the 1st of January. Yes, Lexi?
On those boosters, we're hearing from the Sunshine Coast staff and also Townsville that they're running out of vaccines for booster shots. Do you know anything about that?
I can get some further advice for you. Dr Gerard may have some.
You're saying
Yes.
they're all staying open, but Central Queensland's are closing from December 24 right through till the 4th. That seems extraordinary, doesn't it, that they're closing all their clinics, the state clinics, over that period?
No, some will be scaled down and scaled back up. Look, people deserve to have a bit of a break as well, as you can appreciate that.
It says on the website they're closing.
Well, no, it's not closing. No,
Premier,
they're definitely not closing. Yes.
Would you hit 90% today? Why can't we make a prediction on when we'll get 90% double dose?
Double dose is around early to mid-January. We don't have the exact data at the moment. We should be in a better position towards the end of the week.
Are you looking at changes to that day 5 test, or that will stay as well?
Not at the moment, but we will re-examine that on the 1st of January.
Premier,
Okay?
I'll just ask for the people that are flying in, can you see how there was a plane load of people this morning, a person that I know was on that plane, not one single person was checked for their 72-hour test. Yet you have a look in New South Wales this morning, Premier, and all due respect, I know that these discussions become heated, but can you see that the lineups in New South Wales, the lineups in the ACT, Premier, and Victoria are causing people...
I think you're wrong. With all due respect,
Have you seen the lineups?
I have, but 10% of the lineups are for people who want to get their PCR tests to travel all around Australia, not just for Queensland. 90% are people who are concerned that they have the Omicron variant and want to get tested. That is why we need AHPPC to actually agree to the rapid antigen tests, to get them approved, and then the federal government to source the rapid antigen tests.
How do we know those numbers, the 10%? How do we know those?
That's our advice on how many people are coming into Queensland. We've got the data. Yes, we have the data. Yes, we have the data. Yes, Josh.
There are hundreds and thousands of workers, police and health workers who still haven't been vaccinated yet. Are you worried about those numbers?
Look, we have the vast majority of people having their vaccinations, which is really good, especially in our critical industries and our frontline services personnel. It's very encouraging. And across the state now, such good numbers. I don't have the map with me at the moment, but in southeast Queensland, nearly everyone is at over 90% first dose, except Gold Coast, which is still around that 89%. And can I do a big shout out to Mackay? Mackay is around 94%, sorry, first dose, which is incredible if you think back to before we ran that campaign, how Mackay and Central Queensland were really lagging in the vaccination rates. But now we know we need to get the boosters. It's really important that people who need to get their booster line up and get their booster when it's due. So the advice at the moment is 5 months to get your booster shot. You need to get this booster as an added protection.
What would you do with all the health workers who haven't got a vaccine yet? How are you going to get them across the line?
In terms of a large proportion of our health workers have had the vaccine. But what we know with this variant, and this is where we have to bring in this mask mandate, is it takes a lot of people out. It's so contagious. We're going to have a lot of people in industries that will be down because they have contracted this virus. So we want to avoid that as much as possible by having this added protection of this mandate of the mask, which was actually recommended by AHPPC, so Queensland will be doing it.
What would you do if the Commonwealth
Sorry?
What would you do if the Commonwealth were to cut funding just for Queensland for testing unless you eased?
Oh, that's ridiculous.
The Premier,
That's ridiculous.
Well,
We can address that issue.
You believe that only 0.022% of the people tested in the last 24 hours of 34,518 come back positive. Do you think the community, in looking for encouragement in your appeal for calm, should welcome that?
Oh, look, it is very encouraging that we are not seeing people very sick in our hospitals, but these are early numbers, and our projections are the numbers are going to escalate very quickly unless we do some things like wearing the masks.
Do you think proactivity rather than responding to the most recent data is the way to go?
Look, I honestly think that we are in the new stage of this pandemic. Look, Queenslanders, we can face anything, and I think the Australian population can face anything as well. But we are still very early in getting the data about the long-term impacts. And of course, we want to keep as many people safe over Christmas and New Year.
Premier, can you explain why Sean Drummond reports to you vet data, and is this a vote of no confidence in John Wakefield?
No, John Wakefield's been doing a great job. Sean Drummond is going to be the Chief Operating Officer with sole responsibility for looking after the hospital and health services across this state. I make no apology for this. This is an added boost to Queensland Health. We know we are going to see surge capacity over the coming weeks and months. We are going to see thousands of cases of Omicron in Queensland. But what is encouraging at the moment, and from speaking to my colleagues in other states, is that we do not have large numbers of people in ICU. So fingers crossed, but these are early days. And can I just say respectfully to everyone here in this room and to people watching out there in the public, we want Queenslanders to have a safe Christmas and New Year. And the way to do that is to think about where you're going and think about your movements, making sure you're checking in, making sure you're wearing your mask. I'll be wearing my mask as much as possible in indoor venues. I went to the theatre yesterday and there was a lot of people everyone walked into that theatre wearing their mask, everyone walked out leaving, and half the theatre had their mask on. So now we're asking people to put their masks on because people do not yet have their boosters. So until everyone has their boosters, we need to look after one another. So it's a very small request. It has been requested by AHPPC, and Queensland is moving on this to protect our state.
Sorry, is there any other case where a Chief Operating Officer doesn't report to the Director General but reports to the Minister directly?
Well, you'll have to look. I think it's based on the New Zealand model, and that I understand works very well.
What are you doing to address
We're Queensland. We can do whatever we want here, excuse me, in terms of how we have reporting requirements.
What are you doing to address the testing lineups here?
Sorry?
Just here in Queensland,
Yes.
what are you doing to address the testing lines here? Because there's hours and hours of delays, and you've seen what's happened interstate. Some testing clinics are closed already for the break.
Yeah, no, we had a briefing this morning. We have adequate capacity. The Chief Medical Officer, CMO, will talk a little bit more about those testing capacities across the state. When I've driven in each day, I've been looking at the queues over there at South Brisbane. They've been moderate, but that's going to change across the state over coming days.
The big numbers in New South Wales today, Premier. Are you worried about the border?
I've spoken to the New South Wales Premier.
Yeah, I've seen the big, huge numbers.
We've had a great conversation.
If you're worried about
10%. 10%.
I'm not asking that. I'm asking, are you worried? Will there be a point where you think you have to restrict people from coming back into Queensland?
I don't think that's a case at all. As soon as the rapid antigen test can be approved through AHPPC, we will be able to put them in place by the 1st of January. It's not long to go.
Why not ditch the day 5 test when people are up? Surely that's an easy...
No, everybody knew our plan. You were all here when we launched our plan and everyone accepted the plan.
But surely
the plan was changed that you brought forward.
Okay, we're just going around the circles now.
Just quickly,
Yes,
GPs
Josh.
and pharmacies are reporting a lot of abuse at the moment. Are people losing their minds out there?
Sorry, in relation to...
GPs and pharmacies, in terms of people not wearing masks, people not checking in, there's a lot of confrontation.
Oh, look, I ask everyone to have to please be calm. You know, everyone's been through a lot over the last 2 years. It's been tough. Everyone's had to change the way they live, the way they go about things. And like I said, we're entering this new stage of the pandemic, and you know, we just want everyone to make sure that they check in, make sure that they're wearing their mask, keep washing their hands, and you know, socially distancing when you can as well, until the population gets the booster.
Just one for Dr. Gerard.
Yeah, I'm going to go to National Cabinet, so I'm going to leave Dr. Gerard with you. Thank you. Thanks, everyone. Thanks.
Thank you. Doctor, those 186 new cases, do we have a breakdown of those where they're required from? Is there a new super spreader event, or this is just extra cases?
Maybe I'll start from the beginning. There's not a single super spreader event. So today in Queensland we have 186 new cases to report. This is a substantial increase from yesterday, and not surprising because we have a very contagious virus in Omicron, which has become the dominant virus here in Queensland, and also because there has been a lot of testing in the last few days, so an increased amount of testing. We know that vaccinated people can have very mild illness, and so they can be in the community and not know that they are carrying the virus. And that's probably the reason why we're picking up more cases. One of the things that I am finding reassuring, and again I've been speaking to the hospitals around the state, as of last night there was still only one patient in any Queensland hospital with any symptoms, or significant symptoms, related to COVID-19, significant symptoms related to COVID-19 that was keeping them in hospital. And this was a patient that I've previously mentioned them, who has multiple medical problems. So it appears that the vaccines are working effectively. Now, it is a time of anxiety for all of us, because we have to work with limited information and make decisions with limited information. But the more we learn, the more we are reassured that the vaccines are effective in reducing eliminating severe disease, and that's really what we're talking about. Most of the patients that I have seen with Omicron who have been vaccinated have had trivial symptoms, the vast majority. So the total number of cases seen in Queensland to date is 2,613 since the beginning of the pandemic. There are 447 cases active at present. There were 29,902 tests completed yesterday. And I just again wanted to back up what the Premier said a minute ago. This virus is spreading rapidly through the community. We know that. It's happening around the world. We're certainly not unique. It's new. This increase in the mask mandate, I think, is useful in terms of requiring patrons in cinemas and theatres to wear masks at all times, and also the staff in hospitality venues to wear masks at all times. In reality, most people are doing it anyway. And we want people to go above and beyond the mask wearing that is required under the law. I'll keep going. So we've administered 15,698 vaccines yesterday, and more than half of those, 9,408, were third doses, and that's really important. Again, if I must emphasise it's the older and more vulnerable people that are most likely to get sick, and these are the ones that are getting those third doses, and they're the ones that we want to target, because those are the ones that got the vaccine early. 85.05% of Queenslanders 16 years and older have been fully vaccinated, and 89.94% have received at least one dose, and we will certainly reach 90% today. There were 79 confirmed, or there have been a total of 79 confirmed cases of Omicron in Queensland so far. That lags quite a bit because it takes a few days to get the results back. Omicron is clearly becoming dominant. It will completely overtake Delta. We expect fewer and fewer Delta cases as time goes by. Of the 186 cases reported in the last 24 hours, 177 are still under investigation. And again, we know as the numbers increase, the amount of investigation that the public health units will do will reduce. That is not expected. That happens in a pandemic. That is always something that we always expected, and we will, as time goes by, wind back the public health response. So we won't investigate every single case to the nth degree. Three cases have been shown to be linked to interstate travel. 4 are contacts of known cases, and no cases have been associated with overseas travel. As previously, we've had locations across the state, Cairns, Townsville, Central Queensland, Wide Bay, Sunshine Coast, Darling Downs, West Moreton, Ipswich, Brisbane North and South and the Gold Coast. So it's everywhere. And we know that we're not picking up every case. We know that. So that number of 186 is an underestimate of the real number of people in Queensland who are already carrying this virus. There are 112 people receiving care at home as we increase our processes for managing people outside hospital. There are 79 people in hospital at the moment who have COVID, but only one of them is in hospital because of symptoms related to COVID, and that's the patient who has a lot of other medical problems as well. I think I'll leave that at there.
On
Okay.
the hospitalisation piece, while you're on that topic, are you aware of any case in the country of a Omicron positive person being in intensive care?
I think New South. No, I don't know. There are COVID cases. I don't know for certain. I think there are COVID cases in New South Wales in intensive care, but I don't know if they're Omicron. I don't know that. If I can come back to a question you asked before, I know a little bit more about the vaccination clinics around Queensland. I can't say specifically about I think you asked about a vaccination clinic in Cairns. What I can say is that some vaccination clinics are being closed, but being replaced by other vaccination clinics with new leases. So there is certainly no reduction in the vaccination capacity, and there is an increase. So if there is one area with one particular venue, and I don't know the venue you referred to, it is possible that lease is ending, but it will be replaced by another lease. So the capacity is most definitely not decreasing.
What would you say, Dr. to members of the general public who might be a bit
Major one at the convention centre is also closing. Is that a wise idea? That's closing from Christmas Eve to 4th of January. Because that would be an area that people would walk in for boosters and...
The convention centre one, each one's of the plans on these vaccination centres are being changed day by day. I would want to have more information about that specific venue. It is our aim to maintain high levels of vaccination status in clinics across.
We got the booster there, and there was a big sign saying closed from 24th to January 4th. But it's one of our major hubs. So the question was, why would we? Most
of the closures. I cannot tell you about that specific venue. Most of the closures are only on the public holidays, but we can get back to that with that information.
Doctor, there's information that we've received about a management team at QE2 Hospital. There's positive cases in that group. Have you heard about this cluster?
Not that specific cluster. It does not surprise me at all. There are cases in all industries around the state, including the health industry, and there are tens of thousands of people employed in health.
Are there any other clusters that you've noticed?
No specific clusters, large clusters that I haven't mentioned, that I know of or have mentioned.
Sorry to interrupt, the comments from Web ABC, Townsville and Sunshine Coast and others saying boosters are running out, they're running out of shots for people. What can you tell
That's
us
not
about
the
that?
information we have. We are briefed regularly on vaccine supply. That is not the information that I have.
Doctor, what would you say to the members of the public who might be a bit confused about the government's proactive, strong, ongoing response? And then they hear you talk about low numbers, mild symptoms. How would you address that sort of conflict when they're processing all that information, hearing about an escalation of mask wearing? No, this is important. That's a very good question. What we are talking here is about numbers. So if we have a few hundred people who are sick who are infected, as we do at the moment, and say 1 or 2 ends up in hospital, that's not a big deal. When we have 10,000, 20,000, 100,000, then it becomes a very big logistic exercise. So this is about numbers. That's what the problem is with a pandemic. So even if you've got a very low rate of hospital admission, if you have very large numbers of cases suddenly, that's when it becomes a problem. And we are going to see many thousands of cases in Queensland in the next few weeks.
and that's what all our planning has been focused on.
Deputy Commissioner, could I ask, if possible, please, can you see why people are questioning the system here in Queensland when we have plane loads of people arriving, and we know, and you've said it publicly before, people for the most part do the right thing, but there's those that don't. Can you see that the logic has been twisted here because people are arriving via plane and are not being checked by your officers? I know there's a strain on your officers. That's not the criticism. The criticism is obviously the directions that's come from the government. And why aren't we checking every person in an airport, but yet on the road borders everyone stops?
Okay, so you're quite right, and in terms of people's understanding of things, and if I can try and clarify how we're trying to do this and why we're doing it. If people are expecting to see a similar sort of regime as we saw previously in the pandemic, where there's like a 100% gateway check, like you could not get through the airport unless you were checked, that is not what's happening now. What we've done is gone away from 100% gateway approach to an end-to-end compliance system. So from the time people apply to get their border pass, and I've just done it, I've just come back from Victoria, I've got a border pass, I travelled, I did everything I had to do, I uploaded the documents, I got tested, I had my vaccination certificate, and I got my day 5 test, and it's all come through very clearly. I didn't get checked at any time. And I was travelling privately, so people had no idea who I was. But the system worked because I engaged with the system, and like the rest of the community, I knew what was required of me and I did what was required of me. And I'm absolutely convinced, through our end-to-end compliance checking, so we do audits of the border passes that are in the system, we do checking at the airport, and that comes down to the numbers of people that are travelling at the time and the resources we have there. For instance, there was 8,782 persons yesterday that went through our airport that we processed. And we had 38,772 vehicles that were checked. The levels of that checking will depend on the resources we have and the flows at the time. We're now in a place where we're trying to get the state back open. We're trying to allow people to come back into Queensland and to travel into Queensland under certain conditions. Most of those people are meeting those conditions. We can adjust that. Now, if the Dr. Gerard was to say to us, we're very concerned and we need to check more closely because of the risks to the community, we could adjust that. But we are balancing that risk for the community against the need to open up the state.
Work more closely with the airlines, Deputy Commissioner.
We work very closely with the airlines.
Airlines like a boarding pass, for example, of any passenger going to Queensland is stamped with someone who's had the PCR test, who's been double vaccinated, and that takes all that pressure off the other end.
Yeah, well, you don't get a border pass to come into Queensland unless you've uploaded the documents, and then we are, of course, sometimes people aren't getting their tests back. We understand all of these things. So case by case, we will deal with those individuals as they come through.
Deputy Commissioner, could you, in all honesty, your most honest answer here, would you like to see this system change as it is at the moment, because it is applying an enormous amount of pressure to your police?
Look, we've had pressure on us all through this pandemic. It's nearly 2 years now. We've been working on this. I think Queensland's got remarkable outcomes, and we're continuing to see remarkable outcomes in this state. The system is based against what the current threat is to our community from COVID. And as you've heard from the doctor, we are seeing, whilst we're seeing an increase in cases, we're not seeing an increase of seriously ill people.
Last one.
So I'm very satisfied where the system's at. It will change. Of course it's going to change. Once we hit 90% double dose vax, there'll be more decisions made, and I'm sure we'll adjust to it. And our officers will keep working very hard. And I'm going to finish off by saying, you've seen another change today with the announcement around masks. So we're still handing out 147 masks yesterday. So the message to everyone in the community, carry a mask and wear them when you need to. I'm going to say the Queensland community is doing a great job. They're continuing to do a great job, and we really appreciate that.
Do you have any numbers on arrests for people being belligerent, not wearing masks?
Josh, what I can tell you is yesterday we didn't have any arrests. We had 3 pins. They were all border breaches, but we had 102 calls for service, 30 related to individuals believed of doing the wrong thing under the public health and social measures, and 72 businesses. All checked out, everyone was compliant, and we were able to get them on board, so no fines.
So how would you police the rapid antigen test, Deputy Commissioner? How would that...
Well, that'll be a matter that we'll work through in terms of what that looks like once it's approved, if it's approved, and we'll adjust our system as we have all the way through.
Do you have the numbers on police in isolation and...
The latest figure I have, I think we now are up to 8 officers that are members that are positive, plus some family members as well. I understand the numbers of people in quarantine has not changed to 111, although I do understand 40 are eligible to leave today if they get a negative test.
All good?
Thank you.
Thank you.
just on the booster shots, and the Sunshine Coast, they've said